Hi everybody, welcome to Module 7, Part 7, Replacement Behavior. Okay, so now we've gone through antecedent and consequential intervention. We're going to talk about replacement behavior. Okay, so what is replacement behavior and what is differential reinforcement? Okay, so in this recording, we will talk about these two things. So what is replacement behavior? Now, replacement behavior is intervening the behavior of concern itself. Okay, as you can see here, we've spoken about the A and the C, and right now we want to work on the B. Okay, because it is not ethical to remove a behavior, okay, an unwanted behavior without replacing it. Okay, so for instance, if you do not want the child to shout to get help or get attention, what do you expect the child to do instead? Okay, what is a more appropriate way for the child to request for help or attention? Okay, so this is when we teach a replacement behavior. Okay, and when we teach replacement behavior, it requires us to use something called differential reinforcement, okay, which we will talk about it later. Now, replacement behavior is for us to weaken the problematic behavior and strengthening the appropriate behavior. Okay, so in a way, it has two different outcomes here. The first one is to reduce behaviors that may be harmful or interferes learning, okay, which is the challenging or problematic behavior, and to increase or maintain desired and useful behaviors, okay, which is the replacement behavior that we want to teach. Okay. Now, so replacement behavior that you select has to be socially acceptable. Okay, so for example, if you're using sign language, okay, it's a particular sign or gesture that is used as a replacement behavior is culturally accepted, okay, by the individual or the family or not. Okay, this is something that you may have to take into consideration when you're teaching a replacement behavior. Okay, so for instance, if you work with a child who flaps hands, okay, and the replacement behavior is to clap hands instead, okay, is it socially acceptable in the classroom? Okay, because it may be disruptive for the students in the class. Okay, so this is something that you have to take into consideration when teaching a replacement behavior. Okay, next, similar to communication form, okay, when we talk about FCT, the replacement behavior here has to be recognized by multiple communicative partners. Okay, it has to be understandable by the other people who communicates with this individual. Okay, and allow the learner to access to reinforcement immediately. Okay, so we spoke about what matching law is. If we want a behavior to replace the current challenging behavior, the effort has to be less. Okay, the reinforcement that comes with the replacement behavior has to be larger than the challenging behavior. Okay, so this is how we can manipulate the response effort and reinforcement in order to increase the value of reinforcement of a replacement behavior. Okay, so a replacement behavior must always be more reinforcing than the challenging behavior. And it is best if the replacement behavior and the challenging behavior share the same function. Okay, then it is easier for us to find a replacement behavior, okay, because it is functional based, right? So as spoken earlier on, it shouldn't be more effortful than the targeted behavior when we look at it from the matching law point of view. Okay. Now, here are some examples of replacement behaviors that you can teach to replace the challenging behavior. Okay, for instance, if you work with an individual who bites fingernails, okay, a possible replacement behavior here is to get the child to bite chewy tube. Okay, so you can put the child on a time-based schedule, okay, where he can, if it is not socially appropriate, okay, so he can do it privately in his room on a scheduled time. Okay, so or for older individuals, you can probably provide chewing gum or snacks, okay, for them as a replacement behavior. Okay, the next one, running away to avoid tasks, is definitely a challenging behavior because especially if it happens in a classroom, it may disrupt the whole class. Okay, so a functional replacement behavior here is to teach the child to request for a break. Okay, so by providing I need a break communication visual or pegs, okay, or the child can even raise hands and ask for a break. Okay, so instead of running away, he can still get away from the task by appropriately asking for a break. Okay. Okay, so next one, shouting to get attention. Now, a replacement behavior for getting attention is probably to get the child to tap on the shoulders to get attention. Okay, so when you are teaching a replacement behavior, what do you do is that you put the challenging behavior on extinction. Okay, so meaning you do not provide any reinforcement when the individual is engaging in challenging behavior, and instead you reinforce the replacement behavior. Okay, so in this case, the individual likes biting fingernails, okay, and whenever she bites fingernails, you are not going to reinforce her, okay, so do not give attention to the behavior and immediately provide the replacement behavior, which is probably providing the child with chewy chew, okay, and get the child to bite on it, and then you reinforce after that. Okay, next one, similarly for the child who avoids tasks by running away from the table, is to put the behavior on extinction. Okay, do not reinforce whenever a child runs away. Okay, instead, immediately get the child to sit on the table again. Okay, and immediately prompt the child to ask for a break appropriately, then only you reinforce. Okay, meaning then only you allow the child to leave the table, okay, to get a break, right? So this is what it means by putting the inappropriate behavior on extinction. Okay, now you may be wondering, hey, isn't that reinforcing the child to escape from the task? Okay, now when we're using replacement behavior, we do not change the function, right? We are only working on the form of the behavior. Okay, we are changing it to something more appropriate. Okay, because replacement behavior is solely working on the form of the behavior, right? Okay, but if you would like to work on why the child is escaping from the task, you need antecedent intervention, okay, to work on the motivation. Like for example, look into why the child is escaping. Okay, is it too difficult for the child, right? If it's too difficult for the child, you may use stimulus feeding in, okay, where you give a shorter task, okay, or cut down the workload in the beginning and slowly increase. Okay, so this is similar to the example that I gave when I talked about extinction birds. Okay, the little girl who throw pencil to escape from task, right? So when we are using extinction procedure, we look at the possible factors of the child escaping from the task as well. Okay, so antecedent intervention has to come together simultaneously. Okay, so what we did was we look into the task and we evaluate if the task is too difficult for the child, or the duration of the task is too long, or the child is bored, okay, with the worksheet because we gave the same worksheet repetitively every day, or is it because it is too difficult for her? Okay, so we look into all these different possibilities and we use extinction, antecedent, as well as teaching replacement behavior at the same time. Okay, so instead of throwing the pencil, okay, she can ask for a break, right? Or she can tell teachers that this is too hard, I need help. Okay, so these are examples of replacement behavior for avoidance or escaping behavior. Okay. Now the next one is a child who shouts to get attention. Okay, so whenever the child shouts, we're not gonna give attention to that. Okay, because the function is attention. Okay, so we are using attention extinction. And when the child stops shouting, immediately go near to the child and prompt the child to tap on your shoulders. Okay, or to call your name or to get attention appropriately. Okay, then you reinforce immediately. All right. Okay, so what is the procedure of putting something on extinction and reinforcing something else, right? That is differential reinforcement. Okay, so what is differential reinforcement? It means, okay, besides modifying the environmental events, occurrence of target behavior can also be reduced by reinforcing okay, the appropriate or functional behavior, okay, and putting the challenging behavior on extinction. Okay, so challenging behaviors are not reinforced. Okay, so this is known as differential reinforcement procedure. Now we call it the DR. Okay, there are different types of DR. Okay, and this is the confusing part where we're going to look at what is DRA, DRI, DRO, and DRL one by one. Okay, so the first one, differential reinforcement of alternative behavior. We call it the DRA. Okay, so DRA is a scheduled reinforcement which reinforcer is delivered only for an appropriate alternative behavior, which is the replacement behavior, to the target problem behavior. Okay, so again, when we are using DR, there are two different outcomes. Okay, so dual effects. It is to weaken the problem behavior and to strengthen an appropriate behavior. Okay, so to make it simpler, we're going to talk about an example here. Okay, so Tracy is a girl with autism. She always spits when she's given demand. Okay, so we can see that the functional behavior here is probably avoidance or escape. Okay, so her instructor decides to ignore her whenever she spits. Now, I understand that it is not easy to ignore when someone spits on you, okay? Because especially imagine if it goes, if you have to go through the extinction burst of the spitting behavior, okay? Not all therapists are comfortable with that, right? Okay, so her instructor decides to ignore her, okay, and provide prompt to finish off the task. Okay, however, when she's completing her task and is acting upon instructions, the instructor smiles and reinforces her for working hard. Okay, so what is the instructor doing here? Okay, whenever she spits to avoid from the task, escape or avoidance extinction procedure is implemented. Okay, so she is not going to escape from the task, okay, if she spits. But whenever she is working on the task, the instructor reinforce immediately. Okay, like for instance saying good job, you're working very very hard. Okay, so this is an example of DRA. Okay, so DRA is putting the problem behavior on extinction, okay, and reinforcing another alternative behavior. Now there is another example, okay, of DRA that you can implement on the same scenario, right? So Tracy again, she spits whenever she's given demand. So what her instructor did was to ignore her spits again and to teach her to request for a break using PECs. Okay, so she's given a 10-minute break whenever she asks for a break using the PECs card. So this is what we spoke about earlier on. It is a type of functional communication training, FCT. Okay, so FCT is also a type of DRA because it uses differential reinforcement procedure. Now, the next one is differential reinforcement of incompatible behavior. Okay, and how is it different from a DRA? Now, it is again a schedule of reinforcement which reinforcer is delivered for the appropriate replacement behavior, but this time instead of any alternative behavior, it is something that is topographically incompatible to the target problem behavior. Okay, and again, it has two different effects. Okay, so topographical incompatible meaning when you are engaging in one behavior, it is impossible for you to engage in another behavior. Okay, so it is topographically incompatible. So for example, if you're writing, it is impossible for you to clap your hands. So this is topographically incompatible, right? So let's take a look at this example here. Ali is a boy with autistic behavior. He self-stimulates by mouthing his hands. Okay, so putting his hands into his mouth, right? His doctor is concerned because sores are developing due to his hand mouthing behavior. So his instructor taught him to chew gums, which is used as an alternative incompatible behavior. Because when he is chewing gum, he can't put his hands into the mouth. So this is incompatible behavior because when he is chewing gum, it is not possible for him to put his hands into the mouth. All right. So whenever he mouths, okay, the instructor will simply take his hands out. Okay. So extinction procedure and pay no attention to him. Okay. So this can be attention extinction or it could be sensory extinction as well. Right. Okay. So there are some differences between DRA and DRI. So technically, DRI is under the umbrella of DRA, okay, because it is also using an alternative behavior, but it is more specific. It is incompatible. Okay, so DRI is under DRA, right? DRA is a procedure that involves reinforcing a behavior that is dissimilar but not necessarily incompatible. Okay, so if you are using a DRA procedure and the two behaviors that you're comparing, okay, so one is replacement behavior, another one is challenging behavior. If they are incompatible, then you are actually using a DRI procedure. Okay, so DRI, on the other hand, is withholding reinforces for a target response that you aim to decrease by reinforcing an incompatible response. Okay, in summary, if you are reinforcing a behavior, okay, any alternative behavior as a replacement behavior, if it is incompatible, it is DRI. If it is dissimilar but not incompatible, then it is DRA. Okay. Now, the next one is DRO, differential reinforcement of other behavior. Okay, so it is a scheduled reinforcement again that is delivered during the absence of problem behavior. Okay, so I reinforce any other behaviors except for the problematic behavior. Okay, so as you can see here, there are no dual effects anymore. Okay, because in a DRO procedure, it doesn't require you to teach a replacement behavior. Okay, so you are not teaching any behaviors here. You are simply reinforcing if the problematic behavior is absent. Okay, now there are different types of DRO, right? The first one is called an interval DRO, okay, meaning reinforcement is delivered at the end of a specific trial, okay, a specific interval of time, let's say 2 minutes in this case. So interval DRO is when the problematic behavior did not occur within the whole interval that you have set, okay, say for instance 2 minutes, and you're going to reinforce at the end of the interval. Okay, so this is what it means by interval DRO. Whereas momentary DRO is that the reinforcement is delivered at specific time if the problem behavior is not occurring at that specific time. Okay, so for instance, again, okay, you're gonna set the interval to 2 minutes or 5 minutes or 10 minutes. Okay, it's up to the therapist and the supervisor. So what you do is at the end of every interval, okay, you will check and see if the child is engaging in problematic behavior. If the child is engaging in problematic behavior, you do not reinforce. But if when you look at the child at the end of the interval and the child is not engaging in any problematic behavior, then you reinforce. Okay, so as you can see here, there are three different intervals. Okay, the blue blocks there is the indication of problematic behavior. Okay, say for instance, you select one challenging behavior to work on, which is shouting, for instance. Okay, so shouting happens 3 times. If you can see from the blue blocks, okay, it happened 3 times. So in the first interval, the child did not engage in problematic behavior. Okay, so I provide reinforcement in the first interval. Okay, but during the second interval, as you can see here, the child engaged in problematic behavior, right? So then in the second interval, I do not reinforce the child, right? But at the third interval, I can see that, the child is not engaging in problematic behavior, and I will deliver my reinforcement at the end of the third trial. Okay, so this is an example of interval DRO and momentary DRO. Okay, there is an example of DRO here. Wong is a boy with autistic behavior. When he's given 10 minutes break, he will flap his hands for the entire break period. Okay, his instructor block his hand flapping whenever Wong flaps his hand. During the 10 minutes break, Wong plays with toys appropriately instead of flapping his hands. He was given a piece of cracker, and the instructor makes several positive comments when he's playing with his toys. So the instructor is reinforcing whenever there is no hand flapping behavior. Okay, because hand flapping behavior is the challenging behavior here. So as long as Wong did not engage in any hand flapping behavior, he will be reinforced. Okay, so it can be momentary DRO or it can be interval DRO, right? Okay, so the last one is differential reinforcement of low rates of responding, DRL. Okay, so DRL is a scheduled reinforcement which reinforcer is delivered during the low rate of problematic behavior. Okay, so it requires us to get baseline data before using DRL. Okay, say for instance, if the child used to flap hands for 10 times in a 5-minute interval, okay, so we are going to reinforce the child if he flaps his hands for less than 10 times within the 5 minutes interval. Okay, so as long as the rate is lower than the baseline, and we will reinforce. Okay, so there are 3 different types of DRL. The first one is full session DRL, where reinforcement is delivered when the number of responding during an entire treatment session is equal or lower than the criterion limit. Okay, so let's say our baseline data shows that the child engages in 15 times of hand flapping behaviors within an interval. So for instance, from our baseline data, it was shown that the child engages in hand flapping behavior for 15 times across the whole session. Okay, so full session. Now, throughout the full session, if I'm using DRL, I am going to reinforce the child as long as he flaps for less than 15 times throughout the full session. Okay, so this is full session DRL. Now the next one is interval session DRL. Okay, so it requires us to break down the full session into smaller sections, okay, into equal intervals. Okay, so say for instance 15 minutes per interval, or it can be 30 minutes per interval. Okay, so up to the therapist or the supervisor. And the reinforcement is delivered at the end of the interval when the number of responding is equal, okay, or below the criterion. Okay, so again, the baseline data shows that within 15 minutes interval, okay, the child will flap his hands for 4 times. Okay, so I'm going to reinforce if it is lower than 4 or when it is 4 times. Okay. Next one is space responding DRL. Okay, so two occurrence of behavior is separated by minimum IRT. Okay, like rapid eating for 2 seconds, IRT to 10 seconds. Now, IRT is something that we haven't spoken about. Okay, so it is inter-response time, which means it is the duration between one behavior and another behavior. Okay, so let's say a child is eating very fast, right? So every 2 seconds he scoop 1 scoop of rice. Okay, so that is rapid eating. Now, if I am using space responding DRL, I'm going to try to lengthen the IRT between the 2 scoops, okay, from 2 seconds to 10 seconds. So I will prompt the child to eat 1 scoop of rice, okay, and then because I know that the baseline was 2 seconds, okay, so right now I'm going to prompt the child and he's only allowed to eat another scoop of rice after 10 seconds, okay, so this is an example of space responding DRL where two occurrence of behavior is separated. Okay, and I'm changing the rapid eating from 2 seconds to 10 seconds. Okay. So an example here is that Colleen sneezes very frequently. Okay, and initially it was a biological reflex. Okay, we know that sneezing is biological. Okay, however, the response has been reinforced incidentally or accidentally by others for attention. Okay, so over time, he sneezed to get attention. Okay, so you can see that the function of behavior has changed over time. Okay, so in order to decrease his sneezing behavior, he is reinforced when he sneezes less than 5 times in half an hour. Okay, so this is an example of DRL. Okay, so the problematic behavior has to occur equally or lower than the baseline data or the criteria that we set. Okay. Now, for assignment for this recording is to think of what replacement behaviors you can teach according to these examples given below. Okay, so look through these problematic behaviors and think of what are some possible replacement behaviors that these therapies can teach. Okay, and we will discuss during our discussion. Thank you.